The state of North Carolina has granted conditional approval to Atrium Health Wake Forest Baptist to build a new hospital in Greensboro, and the spot it's chosen is in the northwestern part of the city off Horsepen Creek Road.
Among other features, the hospital would have 2 operating rooms, 36 beds, and will cost roughly $250 million. But this isn't sitting too well with Greensboro's only other major medical provider, Cone Health. It plans to appeal the state decision immediately. Cone CEO Dr. Mary Jo Cagle saying in a statement the decision is, to use her word, poor. And she adds the same services Atrium will offer in this new hospital are offered by a Cone Health facility 2 miles away. She's referring to the Cone Health Med Center near the intersection of Battleground and Interstate 840. She goes on to say people have options in that community already when it comes to health care.
I just want people to realize that people live here. Human beings live here.
Once again, we're talking about medical centers on Greensboro's northwest side, but there's one part of the city that feels left out in all this, and it's part of the city that's felt left out many times before.
Now, East Greensboro has few resources for health care, and people who live there have to travel to other parts of the city to go to an emergency room or even just to see a doctor. Fox 8's Cassie Fambro spoke to City Councilwoman Sharon Hightower, who says this new hospital would have served East Greensboro better. Cassie.
Councilwoman Hightower says that basically people here in East Greensboro in her district simply don't have access to the health care that they need. And without changes and more resources in this part of the city, they are going to need much more help in the future.
North Greensboro is saturated with health care options, but where we're lacking is East Greensboro.
The announcement that Atrium Wake Forest Baptist received approval from the state to construct a hospital in northwest Greensboro didn't sit well with Councilwoman Sharon Hightower.
We have to normally drive 10 to 15 to 20 minutes to get to a medical type facility.
In East Greensboro, medical care is sparse. There's the Cone Health Renaissance Family Medicine Clinic and Women's Center, and not much else.
I'm really disappointed that they did not even bother to talk to some of the leaders who represent the areas that need medical care.
East Greensboro is also a food desert, much of it socioeconomically disadvantaged. And Hightower says many people who live there can't afford good health care.
They followed the money. They went in an area of affluence.
She says when she looks around East Greensboro, she's very concerned about its people's health with so little access to health care.
Human beings deserve the right to be treated equitable and fair. And all we're asking is for people to respect who we are and to value our lives.
She says ultimately the East Greensboro has been overlooked, and one of her proposed solutions is community health clinics. She says she's going to continue to fight for health equity in East Greensboro and advocate for community health clinics here. In East Greensboro, Cassie Fambro, Fox 8 News.